deficit reflects the fact that when the tax rate recap was prepared in October, there would have been a deficit from a prior year in the overlay of $738. It's probably from a 2006 or 2005 overlay account that finally a case was resolved on appeal, and that resulted in a
But as far as the reval, 110,000, I thought that was up on the other figure. Apparently not.
We actually
maybe
funded the
600.
reval out of free cash.
So there should be a,
And there is, for a purpose.
so there should be a reserve. The overlay reserve will be robust. Right?
Well,
We'll see.
Okay.
Employee benefits. County retirement, we had estimated a 10% increase in this account based upon historic trends. Good news is that it came in almost level funded. I think there was about a $3,200 increase from this fiscal year to next fiscal year. That's really good news. And it is a firm number. What we do is we don't spread our payments out over the course of the fiscal year. We receive a discount by paying the county retirement assessment upfront. So on July 1, what we do is we pay this assessment. The number is set for the year, so that for any employees who go out, they retire, they become disabled, or whatever, this number doesn't change. So this number, so to speak, is cast in concrete. Any additional costs that are incurred over the course of the year get rolled into the next year's assessment. So I'm pretty happy about that. One of the questions that came up is that the governor's proposal included an extension of the pension funding schedule, which is to bring us online with fully funding the deficit in the pension system going forward, or the accrued deficit. This doesn't include that. So if there's anything that happens as a result of the governor's House 2 budget submittal that extends the pension funding schedule, then we can expect a change in the county retirement amount to the town's favor. But what that really means is they're just postponing the pain for some future year.
But the fact that it didn't go up and it's gone up 10% a year for so long, is that means that whatever they were trying to catch up on, they've caught up on?
No, not at all.
So there's no real explanation of why?
It's a mix of our retirees, people who,
People hanging in long and not retiring.
or perhaps even someone who's passed away and their reassessment is no longer being charged. Next item is workers' compensation. We've budgeted 6% increase at $279,000. This number comes from a couple of different places. Number one, the state sets a rate, so every position that exists in the town, with the exception of police and fire, has a rate depending upon the risks associated with that position. Number two, it considers the town's gross payroll, so that that rate is then multiplied out times the gross payroll for each job category. And then the final item that gets considered here is experience. So our experience is factored in. And our experience has been okay. We do have employees who do get hurt on the job. We're not pristine in the sense that we don't have injuries. We do have injuries. Police and fire injuries or disabilities do not affect this account. Those are 111F claims. Those are different from what's considered to be workers' comp. And we do buy a policy for this. So the question comes up, do we self-insure? No, we don't self-insure. We buy a policy like everyone else does, and we pay a premium. And at the end of that premium year, the insurance company comes in and does an audit of the books, and they want to establish that the rate that was charged was appropriate, and they'll either give us a credit or charge us for an additional amount of money. One of the things that we do is we make sure that any contract that we have for consultants includes evidence of the fact they have to provide workers' comp. So something as simple as that when we issue a contract, we require them to submit a certificate of insurance. That certificate of insurance means that we don't have to pay for that insurance. So we have a $2 million field project, we require a certificate of insurance, it means we don't have to pay for it. If we don't have that certificate of insurance, that piece of paper that exists in the file, the auditors can come in and charge that retroactively to the town. So we try real hard to make sure that that doesn't get done. Any questions on county retirement or workers' comp? Employment security is just that. It's the cost of unemployment. We do self-insure for that. All cities and towns self-insure, so we do not pay a premium. Sometimes I hear the fact that we should avail ourselves to the state's plan. We cannot. It's a requirement that we self-insure.
Is that, is also true for the school
Correct.
department? Okay.
Correct. So we set aside an amount every year, which is modest. And there are a number of things that come into factors here. As you probably know, it doesn't have to be an employee who's currently working for the town who becomes unemployed for the town then to be apportioned part of their costs. So there are all types of considerations that come in here, that we're, in fact, responsible for our piece of that employee's payroll, even though they may no longer be an employee of the town and become unemployed through other work. It's one of the quirks of the law.
So when we were in the budget process last year, and in the past couple of years, when we've talked about layoffs, we've talked about putting money in to cover unemployment.
Right here,
There was additional money going into that budget, okay.
right here. Health insurance. The discussions that I had with the board previously, we were looking at an increase of about 9%. When I met with our insurer earlier in the year, they'd indicated that we had a, what's called a band, and the band is the range of potential health insurance increases, and the band that we had was in the range of 7 to 12%. So we were presuming, as based upon discussions, that we would put in 9. We thought that that was a good place to be. The quote came in from our insurance company and indicated that the rate increase, the identical plan with no changes, would be 11.1%. And mathematically, you see that that's about a $500,000 increase if we do nothing. Not proposing that we do nothing, but for the purposes of establishing a budget number, $5,021,039 is what we need for status quo. Let me tell you a little bit about, give you a little bit of some background information about our health insurance plan, and I'll tell you what we're doing to try to bring that number down. First of all, the FY10 budget for health insurance is $4,519,477, and you'll remember that includes about exactly $153,000 that we voted at October town meeting. We voted the budget in 2 pieces. The first piece was done at June town meeting, and then when we looked at new employees coming on board in the school department, we estimated that the cost of those new employees would be about $153,000. So the $4,519,477 number is a number that includes everything that was appropriated at town meeting. We have a total of 326 active employee plans, and those are 237 for school employees and 89 for active town employees.
200 how many?
237 for school and 89 for the town. A total of 326 active employee plans. We have 292 retiree plans, and those are broken down, again, 197 for school retirees and 95 for town retirees. Okay, so it gives you an idea that we insure a pretty big number of people, and I think it's a larger number than many people know.
Excuse me, Greg,
Yes,
when you say active plans, you mean active participants or active?
employees,
Okay,
currently employed.
thank you.
So presently, what the town pays is 70%, and the employee pays 30%. the law, the statute mandates that cities and towns can pay no less than 50%. And I'm sure you've heard stories of communities that pay upwards of 90%. So we're at neither extreme. We're pretty much right in the middle. We do offer an HMO plan, a PPO plan, and a version of an indemnity plan. However, 95% of our employees are enrolled in the HMO plan. Our retirees are broken down between the MedX plan, which a majority enroll in. The next biggest number are enrolled in the HMO plan. And then, because the retirees are located elsewhere other than Massachusetts, there's a breakdown of them in the PPO, and there'll be one or two that are in the indemnity plan. So that just gives you an idea that, again, the mass majority of our active employees are in the HMO, and the largest percentage of our retirees are in the MedX plan. So, what have we done today? Those board members who've been on board for a little while recall that 2 years ago, we began discussions about acceptance of the GIC. It was a negotiation process which required the town and the unions to reach an agreement on implementing the GIC, and that agreement was not reached. So we did not avail ourselves to the GIC plan because it was not something that could be done without a negotiation. And as you know, with a negotiation, there's give and take between both sides. So that was the first initiative. The second thing that was done was last August 1, when our new plan went into effect for this year, we did adopt a new co-payment structure for employees, and that affected the emergency room visits, the office visits, and the prescription drug plan. And those changes, which were significant, and I thank the employees and the unions for their cooperation, helped us avoid an 8.5% increase. And that 8.5% translated to about $320,000. So it was not an insignificant, and that was the amount that the town saved. The employees would have also saved an amount equal to their 30% share. I'm sorry, it's 371,000. I think I said 320, it's 371. So that was what was done for this year. We've gone forward, and I've met with a company that's putting together a review of our health insurance options. And this is a program that's available through participants in the Maya Health Insurance Program, who we insure through. And this review is intended to look at what options are available, choices are available through the existing plan. That would be the Blue Cross Blue Shield HMO plan and the Blue Cross Blue Shield PPO plan. What it also does is looks at options that might be available through other insurance plans. We meet with employees that are constantly reminding us that there are better deals out there, whether it be Tufts, Harvard Pilgrim, Fallon, whatever. So what we'd like to really do is vet that process and see whether what we're being told is true. And then thirdly, the review will include an evaluation of the GIC and what the options are associated with the GIC. I felt that it was important to bring in someone from the outside. The cost of it is very small to do this, to give us an independent and unbiased report. I have not received that report, so if you're looking for and wondering when it was presented, it has not been received as of this date. Other things that we have done, I've approached our insurer, and I've asked them to come back with revisions to our existing plan in an effort to drive down that 11.1% increase. And what they have done is they've come in with several alternatives. The sheet that I've handed out the shaded